here there's a article pulled up, like a sort of review pulled up, where these very bright people at NYU came up with this sort of model based off of the history of what they've noticed, right? So up there you can see that they started noticing sort of these persistent post-concussion symptoms after mild traumatic brain injuries that wouldn't be able to be explained by any sort of structural injury to the brain. So they began noticing that as you can tell where it's highlighted there, that these people, they would go out and after having a mild traumatic brain injury, right, on the surface, they don't really seem to have any issues, but when they would go back to sort of cognitive and activity and so on and so forth, they would have these symptoms where either they're having difficulty with their cognition, they're having headaches, right? They're developing anxiety, and sort of the snowballing that ends up leading to, where, they become significantly debilitated, a lot like your story described. And so there's some history, right? So they noticed a lack of systematic medical explanation and management of their patient's symptoms appeared to actually contribute to the dysfunction that they would have. So they would come out, they'd be dysfunctional either from a cognitive perspective or even physical perspective. When they would try to go back to exercise, they would search for any sort of medical explanation. They would go to their physicians or doctors, and actually not the doctors and physicians not being able to provide any good explanation actually seemed to lead to further dysfunctional scenarios. And that's something that they began noticing, and something that they realized was particularly contributing to these people's functional disability, right? So then, that was stage one, which is kind of when they start identifying stuff, and that's in the mid to late 80s, right? And then, they realized that due to this rationale, they developed some educational materials, right, where people would come in searching for explanations, and, they would, explain, what was going on. And they found that it actually, from a functional standpoint, really led to a lot of people recovering. And then stage three was just ongoing research, which, I think that we're still doing to this day. You want to go to the next slide? So this slide, I think, really demonstrates the sort of multifactorial contributions for your functionality after you've had a concussion, right? So, upper left, you see the square, it says neurological factors, and then you have right next to that objective cognitive. So neurological factors, for example, would be migraine headaches, right? So migraine headaches is clearly a contributor, right? And you have objective cognitive, right? So, on your neuropsychological assessment, right? Maybe you have deficits in certain cognitive domains, so that would be objective. Subjective cognitive, right? That would be, sort of, my mental processing is off. I'm taking longer to do my homework. I'm taking longer to do this work, that work, right? And then right to the left of that, and what I really want to draw attention to is the psychological factors, right? That box right there. And you can tell the centrality of the psychological factors to all those other factors, as well as to the functional outcome after concussions and mild traumatic brain injuries, right? And then below that, you see physical factors, right? So if you're deconditioned, if you're overweight, different things like that, that can also lead to to detrimental functional outcome. But I really want to highlight the psychological factors there, right? If you don't address those and you don't pay attention to those, you will only go so far with your functional outcome, right? If you manage the migraines, that doesn't mean that their functional outcome is going to be good if you don't manage their anxiety, depression, so on and so forth, which, seems to, that might have been the case in your scenario, right? And finally, they actually, within that psychological factors variable and box, they actually describe this whole snowballing effect that I think that you might have gone through, as well as, a lot of people really go through. And I really like this because it helps conceptualize and put an understanding to people's experiences. And I think one of the major things that people that come in with persistent post-concussion symptoms have is not an explanation to their symptoms, right? And that makes them feel isolated and very fearful and afraid, right? So just to briefly go over it, it says first, the person experiences cognitive breakdowns in information, and this is usually due to the actual neurological injury, like the concussion itself, right? So understandably, you would have that after a concussion, right? But then after that, second, when these symptoms persist into the period of return to functioning, right, the person begins to experience failure, frustration, and the inability to perform as usual for reasons unknown to him or her, right? That's when the scary starts to set in. And then you go to your doctor, right? And then you ask, what's going on with me? And then if an adequate explanation is not provided and symptoms aren't managed, then they develop this shaken sense of self, right? So the people that especially know themselves, like elite athletes, such as yourself, right? You have a very good understanding of your body. And when you don't get given a good explanation and you no longer understand why your body is doing what it's doing, that can really, really get to you, right? You have this shaken sense of self, the sense of predictability and control over yourself, right? It begins to unravel, right? And then anxiety begins to set in, depression begins to set in, right? And then fourth, depression happens. Fifth, anxiety and depression begin to set in, as they stated, right? Leading to further cognitive breakdowns, which then fuels the anxiety and depression further. And then sixth, the psychological overlay begins to accumulate over time and eventually may become more functionally disabling than the underlying primary deficits themselves. So that's excellent. And then they actually quote here, which I find absolutely amazing, is that most patients come in thinking that they're crazy. And I think that was something that you described specifically and a bunch of times. I think in your LA Times article, there was a quote where I think someone, another volleyball player, mentioned that they felt like they were going crazy until they got answers and until they experienced or until they found your story and found that they weren't alone. They weren't the only ones experiencing this, right? So the fact that, back in the 90s, these people are talking about literally saying people think that they go crazy. And then now back in 2021, we have people with persistent post-concussion symptoms literally saying the exact thing that these people back in the 90s are saying. Is absolutely incredible. And I think that, if we can get this process out there, that this is what people go through and this is why they go through it, right? It can give them a real understanding of what's going on and be able to sort of take back that control that they felt like that they've lost. And, I think that possibly there was an element of this occurring with you that likely contributed to your symptoms. And again, you're not on your own, right? There's a lot of patients that we have coming in that are having this same exact experience, and one that, we fashion our treatment around addressing each of these issues. So, I thought I would sort of bring this up, highlight it, and then, have on someone else, an attending, Dr. Kevin Bickart, to be able to sort of allude to this, explain it a little bit more, and give us his perspective and his expertise on it.
Yeah, so I think it's pretty surprising that the physicians at NYU back in '92 wrote this paper that now I realize at BrainSport we practice by. We are looking at every part of the picture for all of our patients, thinking about some of the patients who have trouble getting back to exercise, some trouble getting back to math class or reading, writing, some professionals who are just trying to get back to their job or a new job. And every step of the way, if there are some cognitive difficulties, it can be pretty frustrating. If there are irritability, anxiety issues, it can be pretty frustrating and can stop people in their steps. And so by the time they see us, months and sometimes years after the injury, things have really set in. And so we try to pick out all the different aspects that are affecting them and provide them some therapies that we know help. And thinking through the last couple of years of fellowship, doing that every single day, and then looking at this paper from '92, looking at these people who had just realized through all their experience, they wrote this based on 10 years of experience at NYU treating patients across the spectrum of severity for TBI. They obviously recognized the same thing, and they set in motion this model to think about the whole patient. And then, fast forward over the last 5 years, that same model has now been taken to scientific rigor, and they put some numbers on it to say, yep, all of the different things that can influence long-term outcomes do. And the psychological piece, which I can talk more about, is a big player in that. And it's, every time I talk to patients about that, and maybe Hayley, you can speak to this, but it sounds coming out of my mouth and the way sometimes they receive it that I'm saying it's all in your head. And the fact of the matter is the brain's in the head, the mind's in the head, these thoughts are in your head. Yeah. So in a way, it is in your head, but in another way, there's an opportunity right after an injury to get your mind right. And that means putting in place the right education, the right reassurance, and the right framework for gradual return to normalcy, both in physical and mental play or work. And if that's not done, and an athlete or an individual with a concussion is left to their own devices, or the opposite is done, a physician or a team tells them, hey, listen, you have to avoid everything. Don't do anything. Close yourself in a dark room. If you do anything, you exacerbate symptoms. You get one more symptom, or it inches up by a measure of severity. You might risk your brain's recovery. You might risk your brain's health. That's scary to hear. And if that's the message that these people are getting, which we often find that it is, it's no wonder why avoidance of these activities and anything that triggers symptoms, whether it be light or noise, crowded spaces, social settings, emotional situations, stressful situations, or physical or mental exertion, any of these things, it's no wonder why these things are avoided. But doing that, as this paper suggests, it's no wonder why avoidance perpetuates worsening symptoms. And I can kind of tell you about that, but I'd love to hear your point of view on everything I just said.
Yeah, I mean, I think it's really, really great. I now know just how deeply undereducated I was on concussions prior to what I've been through the last many years. But, what you said about brain health was, I had never heard somebody talk about my long-term brain health until I met with a neuropsychologist 18 months after my second concussion. It was just solely on, do you have symptoms that will impede your productivity on a court? That was the framework for literally everything. It was never about, are you okay? Is your long-term health affected? I had no idea that you could have long-term symptoms. The framework I was given by every professional around me was really just, if you don't have symptoms, then there's not a problem. Or if the symptoms aren't obvious, there's not a problem and you're fine. Had no knowledge of sort of that things could non-linearly occur, that if I have something today, it doesn't mean that sort of tomorrow I may not have something, and vice versa. And so I think just that framework, like if somebody had given me almost, what you would give somebody post-op of like a look out for these things in case you have an infection or something, sort of handbook to here's the laundry list of things that could occur if you start to notice these, one, look out for them, pay attention. Two, like don't write them off. And three, there's something we can do about them. That would have made a huge difference, because I spent basically 2 years on a slow decline in every way, thinking I was crazy and having no idea why things were happening. It was like everything I knew about my body and my mind that I had spent so much time training and paying attention to for so long no longer seemed to work the way that it did before, and it was maddening. I had no idea how to fix it, and nobody around me seemed to know how to fix it, but I also didn't know what was happening. So I couldn't go to someone and be like, hi, I'm experiencing post-concussion symptoms. I had no idea that was a thing. I was just like, I don't feel good. I don't know why. So, but I think that bringing in the language of brain health, I think changes things for everyone. It's such a profound little concept, but it changes the way you think about something, just telling somebody like, hey, we got to make sure that your brain is healthy. They're like, oh, okay. Let's do that.
Well, it's a fine line in this same line of research, which, the technical terminology for this is fear avoidance behavior. It's a model that's been used in chronic pain, chronic illnesses of other types, where people avoid certain activities because it triggers symptoms that seem to mean to us, which in some ways it's not surprising to not do that thing. If it causes symptoms, don't do it. And the flip side of that is endurance, the endurance model. And so it's a kind of a sweet spot between the two. Endurance model, as you might imagine, means to endure, to put yourself back in the game too early, to push through the symptoms. And while there needs to be some level of pushing through symptoms, there also needs to be some balance of caution so that you don't exacerbate things and create a scenario where then the symptoms are so high that you begin again avoiding. If you could imagine, I think the most salient example of how avoidance makes things worse, just imagine as it was back in the day, if you will, people used to, after a concussion, lock themselves in a dark room because light felt sensitive to them and noise and crowded scenarios were stressful. And so they were told to rest their brain and mostly spend your day resting in a dark room. And then coming out of a dark room, how do you think that light made them feel?
Right. Yeah.
Much worse than it did right after the concussion. And if you do that in an extended period of time, your brain learns this is the level of light to accommodate to, and it is sensitized. It's not prepared to tolerate and habituate to the normal level of light that is out in the world, that is what you should normally be exposing yourself to. And so prolonged avoidance is not good. Pushing through symptoms too early, too hard is not good. And so there is a sweet spot, and that's kind of what you try to strike with every individual. And, as an athlete, some people need a different type of motivation than other people. And so some people need to be told, it's okay, push through your symptoms. You're 2 weeks out now from your head injury. You can gradually get in. If you get a symptom or two, that's all right. That's natural. That's normal. And then some people also need to be told, now, wait a second, it's too early to jump back in that strong, that fast. And so it is that sweet spot between the endurance and kind of fear avoidance.
That's awesome. That's great. Thanks for that input, Kevin. I appreciate it, man. I know you got to go. You got some kids, some toddlers running around the house. So I'm going to let you go. Okay.
Sounds good. Thanks for letting me on, guys. Good to talk to you.
Meet you.
Appreciate it. All right. That was great.
Yeah.
Yeah. So how are you doing now, though? You're at UCLA Law.
Yeah, I'm at UCLA Law. I would say, kind of what he was saying, like I definitely was in the endurance mode for a very long time, having no idea, sort of, I had no nuance to what correlated to which symptoms and all of that. I just knew I felt terrible. So I pushed and had to push. But that there was tremendous fallout from that. It was like I just would go home at the end of the day after a very long day of classes and, training and hours spent in the athletic trainer for other things and just like basically collapse. Like I was at, totally depleted. So I really felt like I was running on fumes, but was pushing. I didn't really understand why I was running on fumes because I felt like I was doing things the way that I'd always done in a healthy way, be like, okay, so it just, things were not working. And that was really confusing to me. Yeah. Eventually that depletion and just things getting worse by pushing through them just culminated. And I had a stress fracture. I was severely depressed. I could bear, like brushing my teeth was like climbing Mount Everest. Like I was not functional anymore. And so there was no more pushing. It was like, I've got to figure out what the heck is going on, and ended up taking a medical leave after finally getting to some doctors that were at least like, you're depressed for sure, we should deal with that. And then I was in a boot and it was just a mess. And so then at that point we're just like, okay, let's take everything off my plate and see what's there. How much of this going on is maybe attributable to just having a lot of stuff on your plate. It turns out that was not the problem. I was just really, really depleted. And so then it was a long process of sort of adding things back in. But at this point, I'd been pushing for so long that everything was so severe. But I also still had no idea it was because of concussion. So it was then another 9 months until I figured that out. And that was really a divine appointment and a true miracle that somebody said something, referred us to somebody, and it was like, what? Post-concussion syndrome? First time I'd ever heard it. And suddenly everything made sense and I didn't feel crazy. But then it was like, okay, now I got to deal with that.
Yeah.
And went to a neuropsychologist, did the full exam. And that was really eye-opening because it was like, oh my gosh, like I'm severely impaired in a lot of ways. And that makes sense because that does match my experience of the last 18 months. But to have it sort of be able to be quantified and tested and categorized.
Like objectively shown. Yeah.
Yeah. And to, like my ability to deal with numbers was like really bad. Like this neuropsychologist was like, so I hope you're not majoring in like math at this point because this is going to be like really hard for you.
Yeah.
And, I wasn't a numbers whiz before, but I have taken multiple years of advanced calculus. Like I wasn't, totally incompetent in this area. And so that was kind of shocking. And there were things that were harder for me, like reading for long periods of time. Like reading was hard.
Yeah.
I was an English major.
Yeah.
I love reading, So I was like, oh no, how am I going to, get through? I'd been out of school for 9 months now. So it was like, all right, now I sort of have some metrics and let's move forward with that. But I also, what he was saying, sort of like the psychological side too, I was like, I knew I needed to move forward with my life and not just like be stuck, but also that it was going to be complicated.
Sure.
There was so many deficiencies and things, but I was like, I know I got to get back on the horse. So I'm going back to school, but this is good to know. And had always been really passionate about film, but was like, this really gives me permission to sort of take more film classes because watching something is much easier for me than reading it right now.
Yeah.
And I could write. It was like reading things was harder. Like I wasn't impaired. My language skills were there. I had a harder time finding words, and I think still do. But it was good to know sort of like what I need to work on and like do that deliberately.
And then you took that, how you did that coming up as an athlete, and you probably honed that into your recovery, right?
And it wasn't that like I wasn't like in a program, so it definitely could have been done. I'm now knowing what I now know and know about programs that exist. It could have probably been done more efficiently or directly, but it was like, okay, I have things to work on, but I don't really know what to do, so I'll move forward. Was on some medications for the psychological side of things, which helped at least maintain some of the mood issues that were happening and some of the energy. Just like cognitive fatigue was like my number one and still is my number one symptom. Just, my bandwidth was like 4 hours a day. I could like use my brain kind of for like maybe 4 hours a day.
Right.
Having been a person that could have easily done 16 hours a day prior.
Yeah.
So that was tough. It was tough being like maybe at 25%.
Yeah.
And just like, okay, how am I going to do this?
Yeah.
But then sports were then off the table. So that was just, it was like, okay, let's do school. And I think that was actually really good for me, like to work through that and just have a limited amount of stuff to do. But it was like, use your brain, get it to start to adapt and build new pathways and that sort of thing.
Well, we've been talking for a while. We've been talking for a really, really long time. And I think that you should come back because I think we probably have a lot more to talk about. And there's a lot more that I wanted to get to, especially with, the gender inequities in concussion care and different things that. Yeah. So
this is like
we'll save that for another time. I know.
Or something.
Chapter 1's done, right? We'll move on to chapter 2 later. Thank you everyone for joining us. Ran a little bit over time. It's okay, though, because we had a fantastic talk. We covered some great topics. Thank you very much for joining the UCLA Brain Sport Podcast. Check us out, comment, subscribe, and let us know what you think. Thank you so much. Have a great day. Stay safe. Be well.